Clive, I'm Debbie and I'm your nurse for today. Today we need to do your pulse, so I'm going to just gently put my fingers on your wrist and just feel your pulse for a minute, if that's okay. Right, is that all right with you?
Yeah, that's fine, thank you.
Brilliant, that's great. So to take the pulse, I would always use my forefinger and my middle finger. I'd never use my thumb because we have a pulse in our thumb. All you need to do when you're taking a pulse is gently place these two fingers against the patient's wrist and feel the point where you're able to palpate and press gently their radial artery against their radius, their bone, which runs from here to here. By doing that, you can feel the wave of blood as it runs through the artery, and it can give you the idea of how the heart is beating. So I can feel it now, and I'm just gently going to take that for 1 minute. When I'm feeling the pulse, I'm not only counting the numbers, it isn't just about the rate, it's also an opportunity to feel the rhythm, to see if it's regular, and also the tone. So I'm thinking about, is it bounding? Is it feeble and thready? So it really does give me a lot of information. Thank you, Clive. A normal healthy adult will breathe when they're resting at around 12 to 18 breaths a minute. Assessing respiration rate can really help us identify any problems that the person may be having with their lungs or other systems. So it's quite difficult sometimes to assess respiration rate, because when you tell a patient that you're going to look at their breathing, it may actually make them change the way they breathe. They may breathe faster and they'll feel uncomfortable. So one way we can do it is by taking the respiration rate when we're assessing the pulse. So I'm going to take Clive's pulse today. So as per the previous video, I'm going to put my forefinger and middle finger onto the radial pulse and take that for around 30 seconds. After I've completed taking Clive's pulse, I can then gently watch his chest as he breathes in and out, and I can count his breathing rate. One breath would be inspiration and expiration. So 1, 2, and I can count that for a further 30 seconds. Now we usually record the pulse rate and the breathing rate over a minute. So by recording the pulse rate for 30 seconds, we can double it, and likewise with the respiration rate, we can double it to get the rate over a full minute. When we're looking at respiration rate, we aren't just looking at the number. Just like with pulse, there's lots we can see that can give us an idea of the patient's well-being. So we might be watching how heavy they're breathing. We might be watching if they're using other accessory muscles of respiration, such as their shoulders, which might give us a clue as to whether they're finding it difficult to breathe. If they're in pain, that may also affect their breathing. And we also may notice the subtle things like their nostrils flaring. So there's lots to see. To find out more about pulse rate and breathing rate, along with other clinical skills, please look at our website. Come along to one of our courses.
Please get in touch via email or visit our website, anniebar.com. Our scheduled courses are all listed on Eventbrite at anniebar.eventbrite.com. You can also give us a call on 033 3335 0044.